Happy New Year and welcome everyone. I'm Patricia Shampton, Director of Alumni Relations for Texas Exes, and we're so pleased to kick off another year of Lunchtime Lectures. Thank you so much for joining us. Today, we'll learn about how emotion, language, and communication intersect and how we can facilitate effective communication with neurodiversity and disability. Our distinguished guest today is Dr. Natalie Czimskey, a lecturer in the Department of Speech, Language, and Hearing Sciences at UT Austin. She is also a fellow Texas Ex and has earned all three of her degrees from Texas. She likes to note that she's the biggest Longhorn fan in the department and has an impressive collection of burnt orange regalia. Dr. Czimskey teaches a variety of courses, including Introduction to SLHS, Phonetics, Anatomy and Physiology of Speech and Hearing Sciences, Introduction to Adult Disorders, Language and the Brain, Acquired Cognitive Disorders, and Counseling. She has a passion for teaching and currently explores research interests in instructor compassion and student growth mindset. Her primary research area is adult neurogenic disorders with a special interest in emotional expression and perception in traumatic brain injury. Please help me welcome Dr. Czimskey.
Hi, thank you for that introduction. I'm fairly overwhelmed to be here because, as Patricia mentioned, I am an ex. I'm one of you. So if you go ahead and hit the next slide, I'll prove it to you. I graduated in 2008 with my bachelor's in communication sciences and disorders. I then pursued my master's degree in speech language pathology and kind of ended up with more interests than I anticipated, specifically in neurogenic disorders, which we'll talk about today. And I started teaching for the university while I was pursuing my PhD in 2012, which is fairly atypical for PhD students, but I fell in love with teaching and then continued teaching throughout my PhD. And I graduated finally with my PhD in 2019. You can tell what slowed me down in that picture there on the right. But I'm just really excited to talk to y'all about what I do. I largely, my communication disorders degree is, and we can hit the next slide. My communication disorders degree and my master's degree are largely clinically based. And so the first 6 years of my education was all about how to improve communication in the face of differences. So this clinical underpinning really informed how I approached my doctoral degree. But I have these 6 years that are all about evaluation, diagnosis, and treatment in disorders. And then noticing that I don't know, fascination, of course, that I had with acquired language disorders, that's really where I focused my next research interests. Acquired language disorders are any disorder that impacts language after the brain has developed how it's going to develop. So if you develop until the age of 25 and then have a traumatic brain injury, a stroke, dementia, concussion, anything like that, that changes the way the brain is operating, that's an acquired language disorder. And that's really where I spent the majority and the bulk of my time. Within that area, I got more specific, and I'm really fascinated in the perception and expression of emotion after the brain has changed. Okay, so what do I do now? I do teaching, honestly, a lot of it. I teach 8 different courses in the department, and it's my favorite thing in the world. But obviously, this is kind of the bulk of what informs my teaching as well. So today's agenda, we're going to talk, kind of set some ground rules, if you will, for how emotion and language work. We'll talk about the complexity of emotion. We'll talk about neurodiversity and disability and differences and disorders. And we'll talk about communication breakdowns. we know that they occur, and that's okay. And then we'll have, towards the end, we're really going to talk about how can we improve communication effectiveness knowing that all of this exists. So first step, emotion is complex, okay? How many of you have used an emoji? Probably a lot of you have used an emoji. And you may have even had this experience where you are searching for the right emoji, and you can show the next slide. And you may be like, no, that's not quite the right emoji. It's not quite right either. You can't use the wrong emoji. It can send the entirely wrong message, right? You are adding context to the lexical, the written language that you're sending. A lot of us in the speech, language, and hearing sciences department would actually argue that emojis have really added an important contextual component to written language because emotion is vital to effective communication, right? And you may have experienced a miscommunication via text as well, based on this lack of contextualization sometimes that can exist in that world. So when we talk about emotion and communication, I want to make a few things, I want to bring a few things to your attention. Communication is the building block of human relationships, right? And human relationships are extremely important, okay? Some of you have felt that more lately, well, in our pandemic society, where sometimes we've been more isolated than we have been in previous years, right? Effective communication also requires the ability to extract, interpret, and make inferences about emotional context. Humans rely on recognition of emotion to formulate interpretations of other people's moods, attitudes, character, right? They also need to be able to determine when information or context is emotionally salient or important to determining emotion going forward. And then there are multiple modalities in which we use communication, right? Right now, you get to see me visually here. You're hearing me auditorily or reading captions, right? You may be also reading, of course, like what my slides that I have on the screen. However, not only when you see me, you're not just like visually seeing what I'm doing with my mouth, you're also seeing, is she upset? Is she happy? Is she nervous? Spoiler alert, I am. There's all these things that you can read on a person's face. Also, you can hear it, not just in the words that they're saying, but in the intonation of their voice. We call it prosody. Okay, so we can sometimes have matching communication where my face, my prosody or my intonation, and my words all match. Okay, we would call that congruent communication, but sometimes we use incongruent communication, right? You come home from work and your significant other asks, how was your day? And you say, oh, fine, right? That's incongruent communication, right? Fine would say, yes, my day was fine, but the intonation and maybe the expression indicated not fine, right? And when you do that frequently, and we know what that means, when we have compromised perception, that means we have compromised communication and then compromised relationships. So this is incredibly important, right? I want to briefly show this next slide on brain regions. I'm not going to inundate you with the neurology and the neuroanatomical representation behind all of this, but I do want to show quickly how many different regions of the brain are involved in emotion and language. And this is arguably a briefer of how many, a brief image, if you will, of how many areas are actually involved. But we have the prefrontal cortex with emotion ID, the amygdala you've probably heard of. We typically associate it with fear processing. The language areas are always recruited in emotional perception. And then there's other areas that get recruited as well, depending on what the emotion is and what modality it's in. So there's areas all over the brain, right, that are involved in being recruited to process emotion. And you'll notice these arrows indicating that they all are communicating with each other, right? The brain is a huge network. So you can imagine that any one of these areas is different or experiences damage, or any of the pathways grow differently or experience damage. All of a sudden, we may have incomplete processing and perception of emotion. It doesn't take much, okay? It doesn't take much. And then we may be working with incomplete information when we're communicating, okay? So next, language interaction with emotion, okay? Language and emotion are inextricably linked, okay? We use language to describe our emotions quite frequently. We highlight personal feeling and affect in various forms using language. And again, then on the receiving end, we have to be able to interpret that and attach that meaning to the other person's state to understand where they're coming from, what they mean, what they're feeling, and how we should react to maintain this communication. And again, I'm going to highlight that we have the words that we're saying and what they mean. That's semantic, okay, the meaning of the words. We have prosody, which is that intonation that we put on top of the words. And then we've got our nonverbal communication, like facial expressions, that can also communicate what an individual is feeling. And we use all three of these modalities to determine what the individual might be meaning. With that, yeah, the language and emotion, again, we've said this, but I'm going to kind of reiterate why this is complex, okay? We know that emotion is key to communication. I've kind of addressed that emotion can be ambiguous, right? You can have these three modalities of communicating emotion, face, words, and intonation that may not match, okay? That can lead to ambiguous communication and ambiguous emotion. Prosody and the semantics or linguistics, so the intonation and the words that you're saying have separate effects. This has been noted in previous research, okay? And then we find that most individuals who have developed what we would say typically, okay, have a preference in utilizing paralinguistic information, which means intonation and facial expression, over the actual content of the words when they're identifying emotion, okay? Now, this is key. If I said, again, my day was, oh, fine, you are going to probably, assuming if you have developed largely typically, okay, the majority of individuals with typical development are going to know that my intonation and my facial expression are probably going to be more likely to indicate my emotion than the semantic content of my language, okay? All right, so with that, we've established all of that. Now we bring in differences. We know that neurodiversity and disability exist, okay? We are a diverse people, and that's a good thing, honestly, okay? Like, how boring would it be, okay? There are umpteen million types of differences and disorders. Please note that some of these things that I've listed on the slide here, individuals may consider them a neurotype rather than a disorder or a disability, right? But we have different makeups and different brains that allow us to perceive and express differently. Even if we were all typical, we would still have communication breakdowns, okay? Typical is also like, what is typical? But that's, take my courses. That's fine. We'll talk about that there. But we know when we have these diversities, okay, and these differences, that we're going to probably come up against some challenges in how we communicate. So first, I've got an example here of PTSD on the next slide. So here, this is just one example of how brain function may change in the face of diversity, okay, or a difference. This is an individual with PTSD. This is an example of an individual with PTSD. We have changes in all of these parts of the brain and how they're functioning, okay? When we have conditioned fear in the hippocampus and in the amygdala, and when we have dysfunctional emotional regulation in the prefrontal cortex, and when we have decreased cerebral flow in the thalamus, all of this is going to change how the brain is perceiving emotion on other people, as well as how the brain is perceiving their own emotion and expressing it outwardly, okay? And this can change and complicate how communication happens. So we know, like I said, that communication breakdowns are going to occur because our brains work differently, okay? What I would say is that it doesn't matter if we have a disorder or a disability or a difference or a different neurotype. Communication breakdowns we know occur. Effective communication is not guaranteed for anyone, okay? And I would argue that the burden of effective communication cannot be solely on the individuals who are neurodiverse or have the disorder, okay? If you see someone with a broken arm and they're carrying something in their good arm and they're struggling and you're walking in front of them, do you slam the door behind you and say they'll figure it out? Or do you hold the door open and make it easier for them? And that's kind of what I'm challenging us to think about today, is how any individual can share that burden, if you will, of facilitating effective communication, okay? For those of you who are not aware, communication disorders are prevalent. Data actually suggests that about 15% of the US population has some type of communication disorder. 15%. 15, that's huge, okay? Within that, we can talk about the 1 in 12 US kids between 3 and 17 that have a communication disorder. Approximately 1 million individuals in the US right now have aphasia, which is a language disability secondary to stroke. And approximately 1.7 million Americans sustain a traumatic brain injury every year. If you think you don't know someone with a communication disorder, you probably already do. And if you don't, I've got news, you're going to. Okay, so let's talk about what this can look like for an individual. I've got a couple of examples that I'm going to talk about really quickly before I show you some of my research that I've done. I've had 2 clients that we can actually go backwards. I'm not doing this one yet. One slide back. So I have 2 clients that I like to highlight. I had one individual who had global aphasia years ago. And global aphasia means that both their receptive communication abilities and expressive communication abilities are impacted, okay? This woman had limited output, and she had one stereotypical phrase. And she basically said, oh my, that was all she could say, okay? So I walked into the lobby to pick her up for her appointment, and I was wearing very tall heels, and she pointed at my heels and said, oh my. And I, knowing that my language wasn't going to be 100% useful, I kind of went, oh, do you like them? And like made a dramatic, motion to my feet, and she goes, oh my. And I said, do you want to try them on? And I took one off and I handed it to her and she goes, oh my, right? And so she was able to communicate some, right, using the stereotypical phrase, and me using a lot of motions, etc., and her using her intonation. We were able to kind of have a tiny conversation here, right? But that's a way that this type of acquired disorder and emotion can impact how your emotion and how your communication work. I had another client who really is kind of the client that highlighted or piqued my interest, I should say, in this specific thing. And this was, oh my gosh, it was over a decade ago because it was before I got married. And I came in like 30 seconds late to my appointment. And I said, I'm so sorry. I just got off the phone with my caterer for my wedding because my last caterer backed out. And so we're trying to get everything ready for next week. And this patient had a right hemisphere stroke. And she said, oh my gosh, I love weddings. Tell me everything. Very, very flat affected, right? And this is what happens specifically in right hemisphere stroke. We typically see flat intonation and zero emotional expression. This is largely controlled in the right hemisphere of the brain. And I said, knowing this, obviously, I said, I believe you. Can you try and express that with your face and your voice intonation when you tell me? And she goes, oh my gosh, I love weddings. Tell me everything. And so she got part of it right? And this is very, very common. You can imagine if you had run into either of these individuals, there might be some complexity in your communication, not knowing their history, right? Particularly my client with right hemisphere disorder, RHD. She had excellent verbal communication from a semantic or lexical standpoint. It was her facial expression and her intonation that would leave you a little confused. Next slide, I'm going to tell you what I did with this. So some of my research really focuses on traumatic brain injury specifically and emotion. Basically, we know that individuals with traumatic brain injury have difficulty with interpretation of visual emotion cues and prosodic, or that intonation emotion cues. They also have difficulty matching emotion in facial expressions and in, again, prosodic tone. We see that this seems to frequently, they also display difficulty in perceiving theory of mind or the perceptions of others. And they regularly report that emotional impairments after TBI negatively impact their quality of life. So one thing that I would like to highlight here is that I think is really important is this quality of life metric. We see that the quality of life impact is largely associated with their ability to maintain successful relationships post-injury. And given their emotional communication breakdowns, this is really difficult to maintain successful relationships. And the divorce rate post-TBI is somewhere between 50 and 80%, which is actually, I mean, much, much higher than the national average. Next slide.
Do not push your luck.
Okay, so this is the this is one of the items that I used in my assessment of individuals with TBI. I let them, they just heard these, they didn't see them the way you are right now, okay? But they listened to sentences, and sometimes the sentences, the words themselves were angry, right? Like the connotation of the sentence was angry, and the prosody was angry. So this is a congruent or a matching sentence. And then I would show them the next slide. And I would show them these pictograms, and I would say, what emotion do you think was most predominant in the sentence? And they would point. Okay, then next slide.
I won the lottery.
Okay, Then we would listen to a sentence like this one, perhaps, okay, where the content of the sentence, this is happy, right? But the intonation that they hear it is sad. And I show them this the next slide and I say, which emotion do you think the sentence was conveying? And they have to pick one, not two. Okay. The next thing I did, oh wait, do we have another one? I can't remember.
Someone is following me.
Yeah, this one's creepy. So the content of this one, this is a fear-based sentence, right? The content would be to indicate fear, and then said in a happy way. Again, which one do you think was happening, right? And then one more.
I'm joking.
There's another congruent one, and then another one.
Some people are way too loud.
Okay, so we also did this with neutral content, okay? Or neutral content. Sometimes the sentences were neutral, sometimes the prosodic content was neutral. So this is an angry sentence with a neutral prosody. And next, yeah, so again, they had to determine here's what was going on. So here's what I found. Next slide. So basically, what you're seeing here, so NBI in the light orange, that means no brain injury, okay? The darker orange is TBI, traumatic brain injury. So we see that overall, obviously, individuals with without a brain injury were more correct in identifying one of the correct emotions that was expressed, okay? And that was all they had to do for this one, was identify one of the emotions that was expressed. Note that this far right metric, prosodic chosen, this means if they chose one of the emotions correctly, did they choose prosody? Okay, so note that individuals without brain injury were choosing the prosodic emotion over 70% of the time. That's significantly less, right? Under 60% of the time for individuals with traumatic brain injury. Now, what's even more interesting is that if you looked at some individuals, I had some individuals with TBI who never chose the prosodic at all. So this kind of is one of the things where it kind of depends on the individual with TBI, whether or not they're relying on that prosodic info or not. Next slide. The other task I had them do, the other way I should say I analyzed this was, could they identify if the sentence was congruent or incongruent? So in the event that I had them listen to the sentences again, can they determine that the sentence matches or doesn't match, essentially, right? And again, we see that the individuals with no brain injury significantly outperformed our individuals with brain injury, particularly in incongruent items. Individuals with brain injury really struggled to identify incongruent sentences as incongruent. So what that means is the individuals with brain injury are more likely to hear an incongruent emotional sentence and think they are expressing one true emotion, which means we've got a breakdown. Next slide. And then the last thing I had them do was an expressive task where I asked the individuals to tell me all of the words they associated with angry and happy, as well as some other abstract words. And again, you can see especially the difference in how many angry and happy words our individuals with TBI were able to produce. So we see that we have differences is the big idea. Next slide. What does this mean? This means that changes to the brain can mean changes in perception and expression of emotion. This can lead to communication breakdowns, which is going to impact effective communication and relationships. All right, so what do we do with that, right? We can improve communication effectiveness for all individuals involved, okay? What I like to kind of highlight in my practice, and when I'm talking to individuals and their families who have changes in their communication, I like to highlight the role that the family, that the loved ones, that the friends can play in rehabilitation. Next slide. This means that we're not going to just send an individual to rehabilitation and be like, good luck, figure it out, right? Again, I'll use the broken arm or the broken leg scenario. If someone is rehabbing a broken leg, if you have a kiddo with a broken leg, do you just send them to rehab and be like, send them back when they're better, right? Or are you participating and trying to support them and trying to make their life easier? It's the same thing. So next slide, here's what we're going to do for our friends, our colleagues. First step, half the battle is just being aware of the prevalence of disorders. Instead of writing someone off and thinking that they are, you know, not paying attention, or that's what I hear a lot. Oh, they're just not trying. They're not paying attention. They don't care, right? Whatever. Instead of being in that place, try and approach your interactions with everybody that you can with this idea that I may not know their full neurotype, I may not know their full history, and I'm going to do my best to facilitate communication with this individual as effectively as I can. So what can we do with that? We can pay attention, right? We can consider alternatives, and we're not going to dismiss people because of a miscommunication or a lack of communication. And I just want to say that I have never made an extra effort to communicate with someone and felt like it wasn't worth the effort that I gave. Not once. And this is my whole job, right? So I don't think you'll be disappointed in putting in this little bit of extra effort. So first up, what do we do next? Freaking ask, right? If it's appropriate, and I would argue that a lot of times it may be more appropriate than you anticipate, you can ask someone, hey, do you feel like we're struggling to communicate? What can I do to make this easier? Is there a communication style that you prefer? Do you prefer auditory communication? Do you do better with written communication, right? And if it's not appropriate to ask, if you're not in that situation, I've got more tips, don't worry. Next slide. I want you to try and consider limiting the number of emotions you're displaying, or you can think of it as displaying congruent emotion, right? Be direct about your emotion as well. Especially with my patients with TBI, if they ask me, how was your day? And I say, well, I was late to work because traffic was insane and my kids were nuts. And then I got to work and my parking spot was full. I couldn't get into my garage. And so then I had to walk in the rain, right? And then et cetera, and I kind of list this bad experience after experience. They may be like, oh, okay. Because there's not and this is all very abstract, right? You have to infer that these things made me angry or sad or frustrated, rather than saying, I am feeling upset because X, Y, Z. That is much more effective than a long story that requires inferencing. We want to limit the individual's need for inferencing when you're communicating. Next step. We want to avoid that abstract language, right? We also want to avoid sarcasm. Gets lost really quickly when we're dealing with a communication breakdown, okay? We want to avoid passive-aggressive statements or indirect references when we can. This all doesn't play well, okay? Metaphorical language doesn't typically convey effectively for these individuals, okay? Next up, We really want to shorten our utterances, okay? The shorter you can make your sentences, the more direct, the better. On top of that, slow your rate, okay? Don't feel like you can't leave some dead air to let them process, right? Leave dead air, slow your rate, and then overemphasize your intonation and your stress, okay? It can feel a little awkward at first. I promise you, it is less awkward on the receiving end than it is on the expressive end, okay? So I think that that's a really critical strategy that you can use. And next up, check understanding. I love this, okay? Don't assume that the individual you're communicating with understood you perfectly. So say you can ask them, can you tell me in your own words what you think I just said? Okay, and then you can do the same thing. What I'm understanding that you're saying is, and again, clarify back. Use this back and forth technique to make sure that you're staying on the same page and communicating as effectively as you may think you are. Ask clarifying questions as needed and see if you can isolate where the breakdown's happening. And then if you can isolate the breakdown, you can fix it. I would say like 90% of the time, you can figure out a way to fix it if you identify it. And then next, remember that an individual may have difficulty expressing emotion, but they may not have difficulty perceiving it, okay? Think of my sweet client with RHD. Oh my gosh, I love weddings, tell me everything. She absolutely understood what I had said to her, and she absolutely loved weddings and wanted to hear everything. She could not express it the way you probably would anticipate, right? So you can ask directly at that point, oh, is this something that, you know, is a happy discussion point for you, right? To clarify, and they can probably clarify. You can also use a pictogram chart like I used before, and you don't have to have one like that. You've got an entire keyboard of emojis on your phone, right? You can ask, can you utilize one of these for me and tell me what's going on with you, right? And that can be really helpful. I do this with my son. He's 6. He struggles sometimes. Sometimes he doesn't totally know the emotion that he's feeling, but he can point to the emoji. He's pretty good at that. Next step. Limit small talk. If it's not conveying anything useful, let's just not, right? You're kind of using resources then that the individual may not need to be using, all right? Limit distractions and noise. This is huge. Again, if you have distractions or extra noise that's happening, there are those distractions and noise are utilizing resources from the individual that you want them to be utilizing to communicate effectively with you. Also, give the individual your full attention, okay? So you limit your distractions as well, because you need to be working extra hard to try and combat this, this possible breakdown as well. And use active listening skills. It is so frustrating for an individual with or without a communication disorder, right? If they don't know if you're paying attention because you're looking over here doing X, Y, Z, right? So make sure that you're using all of the active listening skills that are appropriate for the situation. And lastly, I like to tell my students, we're called Humankind. Let's be both, right? Let's be human and let's be kind. To be human is to be a little bit vulnerable, or maybe a lot of bit vulnerable, okay? And I'll shout out to our other Texas X, Brene Brown, right? And then be kind. Assume the best in people when you're trying to communicate with them. I think this goes a long way in making effective communication. I'd like to tell my students that our entire major in speech, language, and hearing sciences is all about loving people well. And this isn't something that you can just turn on when you graduate and all of a sudden you're loving your clients well and you're loving people well. You have to practice this, okay? And it does take practice sometimes, right? But practice loving people well, practice this kind of kind approach to communication and these positive assumptions about people, and give that extra effort to try and communicate effectively, and it goes a really long way. So with that, I'm open for questions.
All right. We do have a few coming in.
Okay.
They're in no particular order, so I'll just read them out. So the first one is from Kelly, and she says she's curious, or I'm curious to know if there's any research about in utero brain injury and the impact on communication, both verbal and nonverbal. And she's also curious to know if there's any connection between utero injuries and neurodiversity.
This is a great question. The answer is yes, there's research on this. It looks pretty different. So when I talk about acquired brain injuries, I'm talking about basically injuries that happen in adulthood exclusively. Those in utero brain injuries, which usually usually they end up being, just depending on how severe and when, etc., they may get described as cerebral palsy, depending on what all is involved. Not always, sometimes. But those injuries end up looking more often like developmental disorders than acquired disorders. And so, yes, there is a connection between in utero injury and developmental disorder. It's so highly variable about how it looks, depending on what area is damaged and at what point in the gestational timeline. It can just look really, really different. Also, sometimes they don't look like cognitive disorders at all. Sometimes those disorders are entirely motoric or physical in nature. So there is research on them. It's a difficult thing to kind of isolate, though. It's so highly variable. I don't know if I answered the question. Did I answer it for you?
You did.
Okay.
You know, there is a connection, but there's so many variables that it may express itself completely differently. So I think that was a really good answer. We've got another one here that you've kind of gone over some strategies for communication, but this is kind of a specific situation. So in a work situation, when dealing with a non-neurotypical person, what are some effective strategies to get across importance of attention to a high priority situation? So an emergency or something along those lines.
Oh, yeah.
And especially if attention is lacking in the person that you're trying to communicate with.
Yeah. The biggest things that I think about is eliminating distractions and direct language. I need you to focus. This is extremely important. There are serious ramifications to this, right? Here is the situation. And again, like those short utterances, and then check for their understanding. That's what I would do. Tell me what you heard me say, right? I want to make sure that we are both understanding the situation in the same way so that we can collaborate effectively, right? So I know I've said a lot of that before, but without a ton of knowledge about the individual, like that's what I would say mostly.
They follow up with a question is, you know, could you possibly provide a resource or a website URL or something like that that gives folks who are working with neurodiverse folks in their workplace, you know, just strategies? We can send that out to everybody later if you want to give that to Lexi.
I probably haven't. I have some that are like geared towards researchers, and I don't know how user friendly they'll be, but let me see what I can find, and I'll see if I can give something out like that.
Okay. We've got another kind of very specific situation. Jennifer works in criminal justice field, and is there any research you know of on how TBI communication issues present a danger to the individual? So she's thinking about TBI clients who find themselves incarcerated and not being able to read others.
Yeah. Well, I think this is really interesting in a couple of ways. One, these individuals are more likely to be incarcerated because of a lack of ability to communicate prior to prior to being incarcerated, right? So this is absolutely problematic. We see higher rates of incarceration for individuals with autism, with brain injuries, with all sorts of stuff because of their difficulty communicating with law enforcement sometimes. And then, yes, it can absolutely kind of increase their likelihood of danger. And we say that we actually see that individuals who have sustained a brain injury are something like, I don't remember the exact number, but I think it's like 7 times more likely to sustain a second brain injury. Because again, they struggle to cognitively evaluate the situation sometimes, know what's dangerous, what's not, what's appropriate, what's not, and it can lead to them having a secondary injury. So you can see how this would kind of formulate a problematic situation in a lot of different ways. Yeah, I don't know, does that make sense?
It does. I think in dealing with a person in that scenario, would you stress that be direct and use those when in your communications, but are there resources or anything for that individual to communicate out?
I think that being direct with the individual while they're incarcerated and after, hopefully, about, hey, here are some of the things that we're seeing that are causing you some difficulties. Here are some things that we can do to, and I would honestly, the thing that I like to work on with patients is self-disclosure statements, teaching the patient to say, hi, I may not communicate the way you're used to because of X, Y, Z. If you will work with me, I can work with you. And self-disclosure statements are incredibly powerful for any individual with any communication disorder, not just acquired neurogenic disorders. They can really kind of put the power in the person who's communicating differently's hands and say, hey, and it's an invitation, like, I'm inviting you to help me communicate with you effectively. So that's probably the most powerful tool I can think of.
Before we jump into another question, Kimberly asked if we could get a copy of the slide deck. So can we do that for? All right, good. Okay. We've got a question here specific to aphasia. So suggestions on how to communicate with people with aphasia, you know, is it helpful or not to try to fill in the blank or try to infer on their behalf?
Yeah, don't do that. I usually kind of stay away from that, and I recommend using pictures and language together as much as possible, depending on the type of aphasia. There's like 10 different types of aphasia, and that's, you know, conservative. But I would say if you can use some sort of a pictorial board sometimes, or pictures, or point to the actual item. Do you want this or do you want this? Do you need this or do you need this? That can be highly effective just to kind of help you fill in the blanks where you can. Some individuals have much more control over written language. Sometimes their written language kind of mimics their verbal output, so it's not as useful. But kind of most individuals with aphasia have something that is intact, whether it's receptive, whether it's expressive, whether it's written, whether it's ability to repeat. So if you can find out what is intact and utilize that the most, I think that's really useful. And then picture board communication is just my favorite form. And it's sometimes referred to as alternative and augmentative communication if you're using a picture board. But I think it's highly useful for individuals, especially those with more severe aphasia.
Gotcha. I found that in my personal background that pictorial communication is very useful with folks with aphasia, so works really well. Lots of comments just thanking you and loving the Humankind comments. I just want to let you know that there's a lot of support and love for you right now. This next question is, has there been an increase in acquired brain injury relating to isolation and COVID?
Yeah. It's not so much related to isolation as much, but COVID seems to be an extremely vascular disease, I should say. So we've seen a huge increase in strokes, huge, in post-COVID stroke and during COVID stroke. And so with that, we've seen a really insane increase in aphasia and dysphagia, which is difficulty swallowing. And so SLPs have been, we're tired too.
Yeah.
My SLP friends are really tired. Also, everybody's stretched thin, but that's actually the area that we're seeing the most increase is in strokes and aphasia.
How about this one? Can you speak a little bit about how cultural diversity plays a role? So
Absolutely.
They're thinking about interpretation of emotions and approaching communication breakdowns, things like that.
Yeah. There is huge. I mean, I don't know that I have to, explain that to anyone totally, but you can use these apps. You can use these same strategies with cultural differences. Absolutely. I think that you can use a little bit more kind of conversation when you're trying to figure out, like, oh, that's something that seems like that might be something that's typical for your primary culture. Explain that to me, right? Explain what that means, and kind of dig into where you're kind of seeing these differences. One of my favorite things that I've learned was I had a colleague or a student, I guess, who used very different body language to convey that they were listening, and I had no idea, and I had to clarify. I'm like, what does that mean? And they were like, oh, that means I'm tracking with you. And I was like, oh, okay, great. Now I know, right? So I didn't come at them like, why are you doing this? I just said, you do that a lot. What does that mean? And they're like, oh, sorry, that's what we do. That means that I'm following you. And I was like, okay, great, right? So we can ask these questions honestly and vulnerably, right? To kind of continue the conversation and the back and forth between individuals who are just communicate differently. I see this happen a lot with deaf individuals, big D deaf individuals, culturally deaf individuals who are communicating with hearing individuals as well, are what's considered appropriate for conversation and for is very different between these two groups sometimes. And so the hearing person may be offended by a conversation topic, whereas the big D deaf individual is like, no, this is kind to talk about this with you, right? Because I'm being open and I'm being honest with you. And so when you clarify that, though, right, and you understand, like, this makes me, you can say, this makes me feel uncomfortable. Are you comfortable talking about this? And they may clarify, like, yes, this is how we are open and honest with each other and make sure that everybody has equal access to what's going on. So yeah, just have those conversations and ask those questions earnestly rather than an accusing way, and it turns out better.
Good advice. Okay, I think we've got one more question in us.
Sure.
This is a fun one too. It's like, what are some ways we can bring joy to language communication? Like, all of this seems a little bit serious, and so are there ways that we can inject humor and playfulness into our conversations with folks that might be neurodiverse?
Yeah, absolutely. It doesn't have to be all serious, right?
Yeah.
Individuals who have neurodiversity or who have experienced disorders or whatever, they still love life and they still have fun. It may just take you asking, what do you think is, what is funny to you? What kind of humor do you like, right? Sometimes individuals who are on the autism spectrum, they may not find humor in the same things that someone who's not, who's considered more neurotypical, right? Again, I hate that term, what's typical, but they may not find humor in the same things, but there may be something that they overlap in, right? And when you figure that out, you can go to that place. I had one patient, he cracked me up so bad, who I could not figure out always when he was joking. He had a traumatic brain injury, and one time he was playing me and I had no idea, and I'm like furiously taking notes, and he finally stopped me and he was like, Dr. Czimskey, don't you think that maybe you have a brain injury because you cannot figure out that I've been joking with you for the last 10 minutes? And I'm like, that's possible, right? If I can't figure out. And so he had to stop me and say, I've been messing with you for 10 minutes and you have no clue. And so, and thank goodness he stopped me, and he recognized the breakdown, right? And stopped me and told me. And so sometimes you just gotta kind of pause and be like, oh, this is you joking around with me. This is you messing with me, and you've got to figure out where it is. And it's different with every client. I can think of so many right now. They all have their own their own ways of digging at me. And so it just kind of takes trial and error with some of them.
Well, thank you so much. That's a great way to end. Thank you so much, Dr. Czimskey, for joining us today and discussing the intersection of emotion, language, and communication. And we truly appreciate you taking the time to join us and to speak to your fellow Texas Exes. Awesome. And thanks to our audience. You attended our very first event of the new year, and we plan to host our upcoming lunchtime lectures virtually this year, but we're also planning a few in-person events at the Alumni Center later this year. So save the date for February. It's February 25th, and our lecturer is Dr. Minnie Kalon, the director and founder of Factor Health. So stay tuned for more information via email, or you can check out the website at texasexes.org/lunchtime lectures. And thank you all for attending today, and y'all have a good week.